And for many Georgia moms and babies, the special supplemental nutrition program for women, infants, and children, commonly known as WIC, is a lifeline, helping provide formula and food.
And tonight, there's a little bit of good news during the shutdown and a lot of uncertainty about the future, of course. Here's 11 Alive's Liza Lucas with an update.
State officials now expect WIC benefits in Georgia to last 2 to 3 weeks, longer than national estimates. And that is good news for the thousands of Georgians who depend on the program to buy baby formula and healthy food.
So we try to keep it by expiration date.
Federal funds are frozen as the government shutdown continues, leaving nonprofits like Helping Mamas to make sense of the situation on the ground.
The biggest thing we're seeing is just an overall fatigue, right? Like fatigue for one more thing happening and the uncertainty of not knowing if the next time they show up for a WIC appointment, if they're going to have access to formula.
Jamie Lackey runs Helping Mamas, which supports low-income mothers with baby supplies. Typically, that means staying stocked with diapers, but right now, formula is front of mind.
There's some for hypoallergenic kids. There's some for that have sensitive stomachs.
The WIC program, funded by Congress and distributed to states quarterly, now faces funding limbo. More than 240,000 pregnant women, new moms, and children under 5 in Georgia depend on the program for healthy food and baby formula. The Georgia Department of Public Health tells 11 Alive that WIC clinics remain operational, with benefits expected to continue for the next 2 to 3 weeks. DPH says it's also evaluating options to extend services as long as possible. A WIC employee who asked to remain anonymous told 11 Alive some babies depend on specialized formulas covered by WIC. They hardly sell it in stores, the employee said. We have it shipped to our clinics or to participants' homes to provide it directly to our families, adding it can be double or triple the cost of regular formula. That same employee also worries families aren't getting enough information to prepare. Without WIC funding, these families are going to have to scramble to find their formula, the employee said, or possibly turn to an alternative that could be unsafe for their babies. We spoke to that employee before the state offered its updated timeline, but the news offered some relief to Helping Mamas.
Now that we know there's a timeline that we're looking at, we can ramp up and get stuff out. Maybe the government isn't there to show up right now, but we are.
The Georgia Department of Public Health says they'll keep watching the situation closely. And in the meantime, nonprofits like Helping Mamas say that they are preparing. And they're going to be here for families should they need support if the shutdown drags on.